Welcome to another episode of Management Muse. I'm your host, Cindy Baldy, and this is my husband and co-host, Jeffrey Tumlin.
Yellow! Welcome to the podcast where we try to inspire better work performance. Thanks for listening.
Hello, everybody. Thank you for joining us today on Management Muse. We are outside in beautiful Houston, where it's a little bit muggy. And
it's not muggy. This is just regular Houston.
No, regular Houston is just Monday in Houston. Right. We're just a little bit melting out here. But, you know, in the day of COVID, sometimes you have your show outside. So that's what we're doing. And I'm Cindy Baldy, and my co-host is Jeffrey Tumlin. Today, we're talking about culture with the wonderful Welela Tereffe. She is Chief Medical Executive at MD Anderson, which that is like very complicated structure. So all you need to know is she's number 2. She's number 2 in the organization. And she's had lots of positions there and lots of experience with trying to instill cultural beliefs in employees. And so we're going to talk to her today about culture. And Welela, in full disclosure, is also like, some people believe we actually are sisters. And that is often how we present ourselves.
It is.
So there you go. All right, Welela, thanks for coming.
Cindy, Jeff, thanks so much for having me.
So the first question is, I guess maybe the biggest question is, how do you impact culture in a large organization?
I think the first thing is to recognize that culture drives everything else. So you have to be thinking about it, talking about it, and moving it forward. You've heard the saying that culture eats strategy for lunch. It eats everything else for breakfast. Employee engagement, in hospitals, patient experience, and so much of how we feel about going to work every day is a reflection of our shared norms and behaviors and our sense of engagement on mission. And that's all about culture.
And what are some of the challenges in a large organization like MD Anderson in instilling the culture?
I think first I'd have to reflect on some of the remarkable advantages that MD Anderson has when it comes to culture. We are 22,000 people engaged on a singular mission to eliminate cancer in the state, the nation, and the world. And I would bet you that if you walked any of our buildings and asked any of our people what our mission was, that 99% of you could tell you.
That sign where it's cancer with a line through it, I think that is
whoever
genius.
Came up with that.
Like, it was.
Yeah. Should get an extra $10.
As soon as that went up, I was like, holy smokes, that's genius.
Yeah. Marketing genius.
Yeah.
And what it is actually simply a reflection of the shared culture that we have. And so we are starting from such a place of great advantage, I think, compared to many organizations that don't have that kind of singular, easily defined, understood mission.
Well, especially like in healthcare, because I mean, you know, you're focused on one thing from pretty much all angles. Yes. Research, taking care of people, all of it.
There are 4 pillars to our mission, and they're treatment, research, prevention, and education. And those 2, I think, are pillars that most of our employees could name very quickly. I think it's so deeply meaningful to individuals to be engaged in eliminating cancer because all of us have been touched by cancer. So that creates a great sense of engagement on mission. But you also feel when you walk the halls of our buildings, that sense of just joyful passion about the mission. You know, I've trained at other cancer centers, and they don't have that special sauce. That strong feeling of connection to the mission that all of our employees have. So we're very lucky that way. But it's also a precious resource. And, you know, we conduct employee engagement surveys every 2 years. And, better than 90% of our employees participate in the surveys. So we get a really good barometer of where we're at. And we have had times in our history where engagement and trust have dipped. And I'll just say, transparently, it's always because of leadership. Leaders set the tone, and they set the culture. So it's a lot of opportunity and a lot of responsibility.
And so what has been the most surprising thing that you've learned as a leader about culture?
I think what's been surprising for me is to realize the power of story, of narrative. You would think that would be well understood, but quite honestly, as a young faculty member rising in the organization, I almost took it for granted that everybody understood and could articulate and connect to our mission. And I didn't see always how important it was that we connect through narrative with one another. We have a president who was appointed in 2017 who has really, I think, inculcated that in all of us as leaders. Because that's what he does when he talks with people, is he reminds us who we are through stories about us. I can share some stories about how we've responded during really major crises, like how as a community of MD Anderson, which is our employees, our volunteers, our patients, their families, how we responded when the pandemic first began. You know, in a very short period of time, we had to radically change the way we worked, particularly because MD Anderson cares for the densest population of immunocompromised people in the world, people who were orders of magnitude at higher risk of dying of COVID were they to be infected. And so, you know, we did all of the things that most healthcare systems did. You know, we asked everybody to mask. We asked everybody to distance. We disallowed visitors, almost without exception. Those kind of things are really hard for people who are going through some of the scariest stuff in their lives. And so asking people to walk that journey of going through diagnosis and treatment without having a family member physically by their side was just so grievous to us. And we know tremendously dislocating and upsetting to our patients and families. And yet,
really no choice.
No choice. And I think people understood why. And I just talk about resilience and creativity. So, as you know, we have these ambulatory treatment centers where people receive chemotherapy infusions, and they're there for, you know, sometimes several hours. And we have a lot of windows so that people can sit and look out. And one day, a husband whose young wife was going through cancer treatment set himself up with his minivan outside the window that he knew she was sitting at and put out a huge sign that he had written and colored and decorated that said, you know, to his wife, "I'm with you." And also, "We're with all of you, MD Anderson healthcare workers." And that was extremely touching to all of us. And it started this great trend where families would do that. They'd hang out outside of the treatment centers where they knew their loved ones could see them, and they'd hold out signs. And I think it just, it lightened the hearts of everybody who got to see it. You know, another thing that our own teams did was that they drew colored chalk pictures on the sidewalks leading into the hospital, encouraging our healthcare workers and telling them that they were heroes and that everybody was really proud of them. And, you know, those of us who enter the buildings for patient care, you know, things got really hard for our healthcare workers for a while there, you know. They didn't have the luxury of staying home until we figured out how to handle COVID safely. They had to go in every day with uncertainty as we were learning new information and figuring out how we should use PPE and what our guidelines should be. And they had to live with a lot of fear and uncertainty while they were doing that. So I think lifting them up was just really meaningful.
And how does that play into the culture?
Because when we do things like that, and it's us doing it, we remind ourselves that of the best of who we are. And I truly believe this. I mean, COVID has been an opportunity for us to practice this every day. When we practice gratitude, it removes fear and it focuses our mind on what we can do to concretely make the day better for one another. It's an amazing antidote. And we got really intentional about it during COVID. we had a daily briefing. Actually, it was twice a day for the first few months. And it was, of course, a virtual briefing, audio and slides. And we had hundreds of people joining for each of the briefings. And we'd give updates. This is what's happening, internationally, nationally, at the state level, in Houston, here at the organization. These are the things we're doing today. And we ended every single day with shout outs, where we would highlight and thank and appreciate an individual or a team for the great work that they were doing. We heard from people who were working fully remotely who said, joining that debrief helps me feel connected. It helps me know what everyone else is doing and what I need to do, and it makes me feel reassured that my organization cares about me. And while it's true that our mission is to eliminate cancer, and that's an outward-facing mission, our mission isn't to care for our people, but to do our mission well, we have to make sure our people feel cared for. And that was really deeply meaningful to me that we were able to do that twice a day for the first 2 months, then once a day for another probably 6 months. Then we slowed down to about twice a week. But I think it made a huge difference.
Hello, Management Musers. Today, I want to tell you a little something about our coaching products. If Lady Gaga and LeBron James both have coaches, why shouldn't you? We offer a variety of packages, all the way from a 12-session package aimed to help you build your management muscle to a 2-session package aimed to help you think through sticky issues and provide you with a second opinion. All our coaches have doctorates in the social sciences and years of real-world experience in business. So stop questioning yourself and pull the trigger. You're worth it. For more information, contact us at culsure.com. That's CULSURE.com. A lot of lessons learned during a crisis. What pieces do you think are going to continue on?
I think that habit of verbalizing gratitude to one another is going to continue. I see it now in the way people interact with each other. I see it in each of our events, whether they be a small meeting or a big town hall. People take time to do that in a way that perhaps we weren't as intentional about before. I think one of the other lessons we've taken from the pandemic is the importance of near continuous communication. You can't over-communicate, especially in an organization as big as ours. We have people working all shifts. We have people whose primary language isn't English. We have people working remotely, hybrid, and on-site. So we communicate through multiple venues over and over again. Our president sends a message twice a week via email to the whole organization. And email is just one venue, right? It only hits a certain segment of our population, but it's incredibly impactful. I'll just give an example. Our engagement survey, which was conducted in February of 2021, showed, not surprisingly, that the level of reported burnout had risen by about 5 points since the previous survey, which was actually significantly better than at most healthcare organizations. But it was something that we knew we needed to pay attention to. And so we initiated during Employee Appreciation Month a focus that we called Back to Wellness, and it's going to continue. It's continuing throughout the next year, and we really want to make it a permanent focus. But as it so happens, May is also Mental Health Awareness Month. And there's numerous data sources to tell us that healthcare workers are at higher risk of mental health challenges, in part because I think it's a field that draws high-performing, perfectionistic people. And it's a field where the stakes are really high, where when things don't go well, you can beat yourself up for years about it. And it's also, a field where many people are fearful of acknowledging their own mental health needs, because most of us, our professional life relies on our licensure. And there's a lot of stigma about receiving care for mental health, and that includes the fear that our licenses will somehow be impacted. And so what our president did, concurrent with the kickoff of Employee Appreciation Month, was to name and value caring for mental health. And he released a message to the institution saying, mental health is part of health, and we need to all remove the stigma from it and get the care that we need. And I can't tell you what sort of an amazing ripple effect it had. I don't know that prior to that time that anybody had spoken on a public stage at our organization about the importance of caring for our mental health. And so many people responded saying thank you. It means so much to know that it's safe to talk about these things and to take care of ourselves that way. And we've continued every week in our own institutional, we have a variety of sort of institutional meetings and town halls to continue on that message about wellness. Whether it's, dealing with life stressors, practicing habits that help us maintain wellness, using resources like we have something called Code Lavender. Have you heard of Code Lavender?
I haven't, no.
So Code Lavender is a term that kind of builds or plays on Code Blue and other code terms that are used in hospitals to alert teams that an emergency is ongoing. Code Blue is the term for someone who has stopped breathing or stopped having a heartbeat and needs to be resuscitated. Code Lavender can be called by any healthcare worker, and what it is a call out to say we need some time for spiritual and emotional care. And so our chaplains and our counselors will come together with the leaders or managers of an area and just create a quiet space and a safe space for people to connect and talk about how they're feeling. And Code Lavenders are sometimes called after really traumatic events for teams, a patient who dies on the operating table, a child who dies of cancer. But they can be called at any time. And it's just an hour or two for people who are usually very busy on their floors or units to just come into a space and, before the pandemic, to eat, to drink, and to talk with people. So we focused on Code Lavender. We've reminded people, about using time off. I'm taking PTO right now, today. But taking time away is so important. And then we've also been emphasizing the message of care for our physical bodies, because as you probably both know, cancer screenings and other kinds of preventive care just fell off a cliff at the start of the pandemic and still have not returned to their regular levels. And it is anticipated that we will see an increase in the incidence of late-stage cancer and cancer death over the next 5 years because of that. So we're reminding our people, use your health insurance, use your flexible spending account, get that mammogram, get that colonoscopy, take some time off of work to do it. So we're looking for ways each week to make sure that we're reinforcing those messages, and then also to train our managers to support people in taking time to care for themselves. That's a hard thing to do in a healthcare setting. I think before COVID, you'd be hard-pressed to find a healthcare worker who didn't just keep trying to come into work when they had a cold.
Oh, for sure.
Mm-hmm. Because we all felt like, how can I let down my teammates? And, this patient was expecting to see me. And I don't think it really came home to us how counterproductive that is. But people need to know that their managers support them in doing that.
Well, and I think a lot of places they don't, because it causes all sorts of problems in the immediate, but actually them coming into work causes more problems in the longer term.
It does.
When it takes out a whole team.
Yeah.
But, and possibly the patients.
Yes. I mean, there's short-term stress, especially on high-intensity units where there are certain staffing ratios you must meet. If someone calls in sick, you got to find somebody else to take their place. In ambulatory settings, you have to reassign the workload. And I do think it's an ongoing evolution for managers who receive kind of pressures from all directions, right? To focus on making sure that people are well cared for. But what we have learned in this pandemic, I think each of us probably individually can attest, I have not had a cold since February 2020.
I have not either.
And that's part of the reason why I will never completely unmask.
I'm with you, sister.
We're together on that. But I'll tell you something else. Have you heard of nosocomial infections? Do you know what that is?
No.
Nosocomial infections are infections that are transmitted to patients while they're in the hospital. They didn't enter with it. But it happened to them while they were there.
Yeah, I knew that happens. I didn't know the term for it.
Yeah, because we like to, make medicine feel out of reach. We create terms that are difficult to understand.
Don't worry.
They're also called hospital-acquired infections.
Yeah, hospitals are notorious for the initials.
I'm laughing, but actually nosocomial infection is one of the major causes of preventable death for people who are hospitalized and for patients of MD Anderson who are often so profoundly immunocompromised. It's a huge issue. And we have worked diligently for years to reduce nosocomial infections in our inpatient units, particularly during respiratory virus season, which covers flu, parainfluenza, respiratory syncytial virus, or RSV, rising in the fall, peaking usually in January, February, and then declining by April. And despite all of our best efforts, we had only modestly kind of flattened that curve of nosocomial infections prior to 2020. We have had essentially zero nosocomial infections.
Oh my God, that's like so crazy. Like masks work.
Yes, masks work. The constant focus on hand washing works, even in an organization like ours, where we have secret shoppers everywhere,
and you have this stuff everywhere. Right. Every door has
You can see some of the people's hands.
Oh, I know. Yes. They're all beat up. Yep. Yeah,
because they're constantly.
Yeah. And I'll say this also: reducing congestion, reducing the density of people works, and it's quite likely that we will permanently.
We
will permanently ask everybody to mask on our highly immunocompromised floors year round. We can't unlearn that lesson. As for reducing the density of visitors, I think that's something we struggle with mightily.
Yeah, it's a catch-22 because
rubs against the need to keep the lights on and treat people.
Yeah, I mean, we've had people at MD Anderson, and you really need. Or you really, I think you do better when you have somebody there and, the time gets eaten up because you're in a conversation you're enjoying or, it just doesn't feel as bad.
Yeah.
And I think that makes everything better. Just feeling comfortable even going into a procedure.
Yes.
Being distracted in a good way.
Mm-hmm. It reduces fear. It also helps to improve comprehension. When somebody is...
Oh, for sure.
Yep.
Yeah.
When somebody's the patient... in a situation of vulnerability, I would guess you can only take in 30 to 40% of what you're hearing. You need somebody else there to comprehend it, digest it, and then re-articulate it to you.
And possibly even take notes on it.
Take notes, yeah. It also is, I think, really important for reducing the stress and pressure on our healthcare workers who hate seeing our patients being alone.
Yeah.
And feel a tremendous need to try to make up what is not there for them when there aren't visitors. And I'll also say, quite honestly, it's raised the level of conflicts between our patients and our staff to not have visitors.
Right, because now I know, for instance, that we would do a lot of the things without even turning to the nurse on the floor. And we just take care of it. And now you feel without somebody in the room with you, there's going to be a longer delay.
Yes.
And you also you're pulling out your mediator.
Right.
So a lot of times the caregiver acts in a mediating role.
Sure.
Yeah. And I should rephrase that. I don't know that there's conflicts between patients and staff, but there are more conflicts between family members and staff. Family members who are concerned that their patient, their loved ones,
because they don't have any oversight. Yeah. Yeah, you fill in the gaps when you don't have any information.
And we've tried really hard to make sure that we're filling in those gaps with virtual means as much as we can. Having family members on Zoom, having family members on FaceTime for conversations. But it's not the same.
Yeah.
And I think especially during the really just times of great emotion for people at certain points in their cancer journey, you need to have more people around you.
And so if I grab a physician and I grab a lab tech and I grab a registration clerk and a billing specialist, what's likely to be the overlap between what they all say is our organizational culture in just in a word or a phrase or a couple words or a couple phrases? What do you think kind of nails that for people? Where they, and the one thing that made an impression on me when you were talking before is you talked about a lot of the other places where you had received your training and that they weren't like MD Anderson.
Yeah.
And so that's sometimes a lot of the ways that
you see what a culture is by what it's not.
saying, "Oh yeah,
Yeah.
oh this feels totally different," and then you name what that feeling is. And so that's my question, because I know you've thought about this a lot, and I know it's very important, and I know you think, and not only think, but have the data to show that it drives a lot of no kidding outcomes. And so what if we were trying to put that feeling into a few words? What would we say that culture is at MD Anderson?
It would be that we go to any lengths to care for our patients. Okay. And this may seem so trivial, but I'll give you what to me is one of the most fundamental examples, and you can see it anytime you're at our organization. It's a big place. Lots of buildings, lots of connections.
2 appointments, 10 football fields.
You got to know your tower, your elevator letter, and
it's
your
sprawled.
floor.
It's like Houston. MD Anderson is to Houston.
Yes.
Right? It's a big old kind of spread out place.
So given that spread outness, it's not uncommon to see people who just have a little bit of a confused or uncertain look in their eyes.
There's the understatement of the morning. People are lost in that place.
And once you learn the structure, you're not lost. Yeah. Once you learn tower, elevator letter, and floor number, you're not lost.
Yep.
But
there's a lot of
there's
a lot of wandering around.
Yeah.
But here's the other thing. You see a person who has that look in their eyes, wait 5 seconds. The first employee who walks past them will stop and say, "Can I help you find something?"
Oh yeah, we've had that happen.
And walk you to wherever it is, walk them to wherever it is they need to go, no matter where the employee was planning on going. And also have a conversation with them while they're at it. Tell me about who you are and where you come from, because our patients come from all over the place, and give them a word of encouragement. "Oh, that's your doctor? That doctor is fantastic. You're really, really going to like that doctor." I see that all the time. I do it all the time. I've never been in an organization where I see that. And that's because we're all ambassadors for our organization, but also because we care about every single person who walks in our doors. So, and I would say we care about our colleagues and our staff that way too.
Yeah. Yeah. So maybe we go to any length to care for our patients and each other. Yeah. Is maybe if we were going to sum it up.
I was going to say something about caring for our patients and each other, but you said it better than I did. So.
Well, I just added.
What would you say?
That's right. That's right.
Yeah. He is the man of communication. Hello, Musers. Now it's time for a commercial break. Today I'm going to tell you a little something about our strategic planning products. Did you know most companies don't have a strategy and most strategic plans aren't strategic? And that just doesn't sound right to us. We'll help you convene your core leadership team and shape a strategy and a strategic plan that's just right for your organization. We offer 6, 9, and 12 session packages led by facilitators with doctorates in management or related fields who also have decades of experience in business. We'll help you leverage your core competencies and your unique insights into a competitive advantage. Contact us at ondemandleadership.com. We're looking forward to hearing from you. And so what would be, you gave an example for taking care, going the extra mile, taking care of patients. What's an example for the employees?
So one of the first asks that came up from our employees at the start of the pandemic, when there were certain groups of our workers who we sent home and whose jobs couldn't be done at home. And so first we created an employee.
What's an example of a kind of employee you sent home but they couldn't do their job, like a phlebotomist?
Well, we still needed phlebotomists to care for patients, but for example,
so you didn't
we shut
send
down.
Them home.
No, we shut down most of our food service. Right? Okay. Because it wasn't safe to have open cafeterias.
Yeah.
And so we sent most of our cafeteria workers
just
home.
Enough to keep the people in the hospital fed.
To make sure that our inpatients were getting their meals.
So maybe 10% stayed and 90%
and plus,
makes sense.
Well, not only that, it's not just feeding the patients, but in the past,
we had a lot of visitors.
They would feed the visitors too. So you might need a much bigger staff, and then all of a sudden, no visitors.
And we were feeding employees as well, but because it was obvious that COVID was a respiratory virus that was spread through activities at close range, we did not want people to eat together. And so we closed almost all of our dining. We did reopen with to-go baskets that people could take, but we had to figure it out for a while. So we created an employee resource pool that helped people who had been sent home and couldn't actually do their jobs remotely to be reallocated to some other activity and get their regular pay for it. So entry screeners,
that makes sense.
that kind of stuff. But there were still some people who couldn't do those jobs and couldn't do their regular jobs from home. And so at first they were using paid time off to continue their regular salaries. But we knew that eventually they would get to a place where they would run out. No. And so, and our employees knew that too from the beginning. And we heard from our people, please help us find a way so that we can donate our paid time off to people who are not able to work right now because of their being sent home. And also to people who may have had, say, extended illnesses because they got COVID. And so our HR teams worked with the state, because as a state institution, these are complicated things.
Yeah, it's another layer.
Yep, and we created a major disaster donation pool, and just thousands and thousands of hours were donated into it within the first week alone. We actually ended up closing the donation pool.
Wow.
Because we didn't...
Too many hours.
We had more hours than we could actually redistribute to
people. Giving them away.
Yeah. So that's one of the ways that people really showed up for each other. We also have something called a caring fund, which allows our own employees and just members of our community to donate money that can then be distributed to employees for certain hardship events, like recovery from a natural disaster, Harvey, Ike, those kind of things. With permission from the state, we were able to expand the allowances for the fund to include hardships created by the pandemic, including the need for, altered like childcare options, displacement from work, and those kind of things. And all it took was for us to say, remember, here's the caring fund. Here's how much has been donated since the start of the pandemic. And, there's a little logo on our intranet site, and you could watch it each week going up. People donating from their own resources to make sure that their colleagues had what they needed. Part of empowering our managers to actually support a just culture is looking at our entire system in terms of its capabilities and controls. Because organizations like ours tend to run on the goodwill of really smart, really talented, really committed people. We ask everybody to give 150%, and we generally recruit people who will do it. And that covers up sometimes for gaps in our processes and our systems.
For sure.
And it also covers up for gaps in our focus. So, we can't succeed in asking people to do certain really important things if we're also saying, also do everything else. And that's a challenge for organizations in general. But I think that's something that we're focusing on, and our strategy plan is helping us to focus on that, so that we don't ask our managers to literally do the impossible. Make people feel cared for, and make sure I never hear about a problem. Right? Make everything run perfectly, and also make sure people always feel good. Those two things can't always happen, but they definitely can't happen consistently if we don't have the right systems and processes in place. The next thing I would say is we have to build up our muscle for that cup of coffee conversation, which is the practice of engaging when we see our peers behaving in ways that they shouldn't. And it's like you said, Cindy, sometimes you just have a bad day. Do you know what I mean? Mm-hmm. I mean, we're human. We come to work with all our stuff, and we're working in high stress environments, and so sometimes that stuff comes out. But it's also true that one negative interaction can erase the memory of 100 positive ones, especially if you're a little higher on the hierarchy. So I'm speaking about physicians particularly. Physicians have this disproportionate impact on culture. I remember as a junior, as a junior attending, it took me a good year or two to realize that my entire care team was living and dying on my mood in clinic that day. Because before that, nobody cared what I thought. Do you know what I mean? Right. I was a resident. And I was still operating from that mentality, and I didn't realize, man, if I'm just in a little bit of a gruff mood, everybody else is unhappy the whole day. And I have to manage that for their well-being and for the high functioning of our team. But it translates to all other areas. And so having the courage to have that cup of coffee conversation when you see somebody behaving that way, I think is really important because it recognizes the goodwill of 97% of people. Most of us don't notice what we're doing, didn't realize what we were doing, or saw it but kind of hoped that maybe it wasn't that big a deal.
Slide, yeah.
Yeah. And that cup of coffee conversation, which is non-punitive, it's not recorded somewhere, is just a chance to say, hey, I know you, and I know who you are, and that wasn't really who you are, and I just wonder if you noticed it. For a lot of people, that's enough for them to go back to those individuals, clean up that mess, and be more intentional about not doing it again. Yeah. And I would say in a hierarchical kind of workplace like medicine, it probably takes a lot more than 4 positive interactions to counteract the negative one.
And why do you think that? You think that it's the kind of power difference?
Yes.
Okay. Yeah. And that depending on who's in the bad mood, it can have a bigger impact.
And it can cause people to feel more helpless in response to it. I would also say there's this challenge, there's this tension between preoccupation with failure and focusing on the negative towards people. So preoccupation with failure is a tenet of a high reliable organization. Highly reliable organizations are constantly concerned with points of failure in order to avoid preventable errors. But those points of failure are about systems and processes. They're not about people. It is so rare that when a patient harm happens, it's because of one individual's actions. It's actually because of a system that over time promotes normalized deviations in the behavior of groups of people that in given situations, if there's enough Swiss cheese holes that line up together, results in harm. And so focusing on individuals is actually really counterproductive because it increases fear. And the more people are afraid, the less willing they are to acknowledge their own gaps or mistakes and to stop the line when they think there might be a concern for safety for a patient. So part of that is about shifting that lens away from preoccupation with who did what wrong.
And back to improving the system, which is actually the underlying problem.
Particularly in healthcare, disruptive behavior can be a sign that someone is experiencing burnout.
Sure.
But it's also so important for all of the individuals around that person as well, that there be a process of escalating consequences for behavior that continues in that way. And, the literature suggests that, that cup of coffee conversation is enough for about 80% of people in healthcare settings. Another 15 to 18% will need some greater degree of coaching, counseling, correction, or support. Yeah. And then there is going to be that 2 to 3% who simply need to be coached out of the organization. But it's a lot smaller
than what's actually happening. Yeah.
Yeah, that's our experiences. In fact, we're fairly commonly will get called for, hey, we need to get the group together. Things are off track, and then we probe and talk a little bit, and it's one person. Right, and so our advice typically is, look, either we can help you have that conversation with the one person, but don't gather 25 people for a conversation.
Yeah, because it's punishment.
Yes,
basically.
Yeah. Yes,
and it's.
And employees aren't dumb.
No, they're not dumb.
They know who we're talking about.
Yeah.
And they also see our cowardice in being unable to directly and privately address it with that individual. Yeah.
Well, and the other problem is that individual may be like sitting, possibly, we get this sometimes, they're sitting there and they're like, well, I don't do that.
Yeah. No, I mean, it's true. Generally,
so they miss it.
Generally, when people have behavioral issues, they also lack insight into their behavioral issues.
Yes, they actually are not introspective.
The message is not getting through to them.
Meanwhile, all their coworkers are going, yeah, this meeting's about you, sucker.
Well,
Yes. Yeah. I think the other thing is that if you start from a place of assuming good intent, the vast majority of people would want to know if they're missing the mark and it's harming their environment.
I agree. I think that they just want, I know I would want the opportunity to fix myself instead of having it just be, I'm moving along, not really thinking about it. And then boom, I'm punished hard.
Yeah.
Whatever that punishment is. Whereas, if you just told me, like, we could have fixed that a while ago.
And I think there is some inner spiritual work that leaders and managers have to do to make sure that when they do enter into those conversations, which always needs to be in private, that they enter it with a spirit of openness towards the other individual, not a spirit of punishment. And I think it's also important that they enter into the conversation simply to encourage the person to engage in dialogue and self-reflection. It is okay to also say there are certain expectations about how we behave with each other, and I'm going to need you to work on adhering to those. You got to adhere to them. But sometimes I think what happens in those conversations it becomes a battle of who's right and who's wrong. You have to acknowledge to me that you did X, Y, Z. Well, people don't. When people feel backed up against the wall, they fight. It's because defensive. They need to save face. So there's no need as a manager to eke some sort of confession or apology out of someone. That's not the point. Right. The point is to encourage them
to go forward
and be their best selves. So, and I'll tell you something else. I've been practicing this with every leadership position I've had, and I've had more and more opportunities to do it over the years. Most of the time when I've done this with individuals, that one cup of coffee and conversation, they say two things to me. I'm really sorry. And I'm not asking for an apology. They just reflect it back. And they also say, often and sadly, this is the first time anyone's ever talked with me about this. I feel very strongly that the hierarchy that elevates physicians to a place where they're not accountable for being kind and courteous to others, or sort of carrying what is their appropriate weight in any kind of situation where there are tasks that need to be done.
Which would rub against, just as a point of fact, that would rub against the culture of taking care of patients and going the extra mile for patients and each other.
It does rub against the culture, although I think there's a big carve out really in our culture for physicians. Historically, there has been.
I think that's clearly beyond MD Anderson,
too.
It
is, absolutely. And I would say it's actually less of an issue at MD Anderson than I think at a lot of places, because we're an employed staff and we really are dedicated to mission. And our physicians, don't get me wrong, go 1,000% for our patients. I mean, most of our docs give our cell phone numbers to our patients. We're taking care of stuff while we're on time away. I know of people who answered phone calls while they were hiking in the Himalayas to talk with a patient who had a concern.
When Cindy was in there, we got one of her results when the guy was on the West Coast taking a water break during a hike with his family. You could hear his kids back there.
Yep.
And he was talking through the...
And, sidebar, we actually want to encourage people to really disconnect when they're away.
Right.
So I'm not saying that's good for everybody, but I'm just acknowledging that just deep commitment that physicians do have to patients. But what can sometimes be a double standard in the workplace around some of the other expected behaviors. What we've experienced over the course of the last 2 years, and that would include both a period of time when we were under review by CMS, Centers for Medicare and Medicaid Services, a very transformative and stressful time for our hospital. And then shortly after that, the COVID pandemic, we saw our employee engagement scores rise significantly in the course of those 2 years.
And I think common battle.
Yes. I think it's because we made meaning out of what was happening in the right ways. Yeah. So one of the first things that we said on it during CMS and we said on it during COVID is we said, we are not about blame and shame. We are not looking for who did something wrong, and we are not firing anybody. We did not use what happened in CMS to dismiss a single person, and nor did we do a single furlough or reduction in force with COVID. We gave our word. No one is losing their job because of COVID. And then I think the other thing is we turned on the communication. Yeah, so during CMS and also during COVID, we had daily or weekly briefings, multiple venues where we connected with people and talked about who we were and spent some time showing our care for each other, having some humor, and focusing on what we needed to get done. I think in doing those things, we actually strengthened people's sense of confidence in one another and commitment to the organization and the mission. I think what's critical in doing that is you have to let people know that you care about their well-being while you're asking so much of them.
Right. And in many respects, like the job is kind of putting them in the direct line of fire.
Yes, it is. And in both of those existential situations, we really revved up and ramped up our focus on wellness and care for our employees. And we're not taking our eye off the ball now, right? There's some level at which, things are some of the pressure is de-escalating as the pandemic slowly unwinds, right? We know that, and we also know that now is going to be the time when people pause and go, I want something different for my life.
Yeah.
We've had very little attrition during the pandemic, but we fully expect attrition to rise. And some of that's okay and good. It may be that some people say, you know what, I think I'm at the end of my career. Right. Or I've realized that there's something really important and different that I want to be doing, and we absolutely want to support that. Yeah. But we also want to make sure that as people kind of process what they've been through in the past year, they don't think, I just got to get out of here. It's the only way that I can experience a sense of well-being.
And that's a really good insight, I think, because basically healthcare has been doing, and there's no thinking with doing. It's just getting the job done. And now as things are relaxing, now the thinking starts.
Yeah. Yeah. And, again, our mission is to eliminate cancer, but we cannot succeed in our mission if we don't have a highly engaged workforce.
So, summary. Key points we've learned from Welela about managing and leading organizational culture. There's no way to over-communicate. Mm-hmm. Look for your champions and make those stories visible.
Yes.
Give the shout-outs. And when you be willing to have the types of conversations that help people course correct when necessary. The vast majority of people want to move in the direction of being good people doing good things. When we see things that are countercultural, we hope that we're creating an environment where everybody feels like they can have those conversations. But that environment doesn't happen overnight. It starts by us building that muscle one conversation.
Jeff, you said it beautifully. I would only add, leaders also need to consistently, as we focus on just culture, focus on systems, processes, and capabilities to ensure that we are creating an environment where people can actually do the good work.
Great. Okay, Dawn, thanks for being part of the Management Muse Outdoor Edition.
Well, I want to thank you both for having this dialogue with me, and I'm excited for people to hear and interact with this because organizational culture is it's everywhere in everything we do. And having the opportunity to learn about it, speak about it, and see it differently, I think can be really transformative for everybody.
We hope you enjoyed this episode. If you want to learn more about the topic, check out our show notes. And if you want to help us out, like, share, subscribe, and 5 stars are all deeply appreciated. See you next time on the Management Muse.